Good evening.
Meeting is called to order.
Hello everyone, a very good evening. I request President Rotarian Lal Goel to please confirm the minutes of the last meeting.
The last meeting's minutes were circulated, and as we have not received any observation or objection, I consider it as read and confirmed. So I confirm the previous meeting held on the last Sunday.
Thank you very much. Moving on, as has been shared with all of you, the topic of discussion today is very interesting, and it is about the role of Ayurveda in keeping our organs healthy. And for this, we have a very esteemed guest with us, Dr. D.C. Katoch, who's a former advisor in the Ministry of Ayush, the Government of India. I would now like to take the opportunity of reading out Sir's profile with you. So, Dr. Dinesh Chand Katoch is the former advisor Ayurveda in the Ministry of Ayush, the Government of India. From 2008 to 2011, he was on deputation with WHO as national consultant and focal point for providing technical assistance. Can we please be on mute? Providing technical assistance and coordination in implementing WHO, Government of India, Corporation strategy for traditional Indian medicine and homeopathy. He was the Senior Chief Medical Officer, Ayurveda, Ministry of Health and Family Welfare, Government of India. He is the Secretary of Ayurveda, Siddha Unani Drugs Technical Advisory Board and ASU Drugs Consultative Committee under the provisions of Drugs and Cosmetics Act 1940. He has authorized several articles and represented India in many international delegations to the countries including USA, UK, Germany, Switzerland, Russia, China, etc. So, sir, welcome to the Rotary Club of Organ Donation International, and we are totally looking forward to listening your talk on role of Ayurveda, which is the most ancient part of the Indian culture.
Role of Ayurveda on healthy organs.
Impact of health of organs, definitely. Sir, over to you.
Thank you, madam, and thanks to all the participants in this forum. I think the topic has been introduced. Now, I would like to start from the basics. From the basics of Ayurveda, means how the health is protected, health is preserved, health is promoted. Now, if you see the constitutional definition of human body, according to Ayurveda, the constitutional definition means how this body is made. It is, if you see the oldest textbook of Ayurveda, the compendium of Ayurveda, it says like this: Sattva, Atma, Shariram, Trayam, Etat, Trindadvat. Means this human body, it has three components. These are the three building blocks of the human body. That is, one is Sattva, that is the mind part. Then the Atma, that is the vital force, or means the factor, the element because of which we are alive. And the third is the physical part. Now, this is the definition. Now, the disease or the, when we talk about health and disease, that is all about the body system, the psychosomatic system. Now, if you see the definition, the functional definition of human body, then it says like this: Dosh dhatu mal moolam hi sharira. Dosh dhatu mal moolam hi sharira means the body is made up of doshas, dhatus, and mala. So what are doshas? Doshas, these are the physiological entities. Means that the whole physiology of the body system that is controlled by these elements, these components, or these factors. Dosha. Dhatu means the matrix of the body, means the different tissues, the structural entities. These are the structural entities of the body system. And the third is excretory elements. Excretory means when the tissues, when there is metabolism in the tissues. So because of that metabolism, certain waste products are produced, and that system, which is meant for elimination of those elements, the excretory product. So that is that we call as a mala. means the waste products. Now, the physiological entities, the structural entities, and the excretory entities, these have to be in balance, to maintain health. This is an important point. So the functional entities, the structural entities, and the excretory entities. Now, these all the three entities, these are decided at the time of birth, and that we call as the constitution, the prakriti of the individual. The basic, the basic constitution, body-mind constitution. So the dosha, all of you know that these physiological entities which I am saying, they are of two types. One, the somatic, and second, the second category is that is of the psychological factors. Sattva, Raja, Tama, these are the psychological, and Vata, Pitta, Kapha, these are the somatic elements for maintaining the physiology as well as the neurophysiology or the psychological aspects. And the structural entities means of which our this body is made up, like rasa, rakta, mass, med, asthi, majja, shukar. Like in the modern system of medicine, we have four tissues: the connective tissues, the nervous tissue, the muscular tissues, and then the epithelial tissues. But in our Ayurveda, we have the seven structural entities, and all these structural entities, they are made or they are formed from the food which we eat, from the food which we eat, and the food after digestion, it gets absorbed into the circulation, and the tissue or the that attribute for the body, that is we call as rasa. And the second is then the components which are required for the formation of the blood, those are present in the rasa, and from the rasa, then that transformation occurs in different organs. It could be the bone marrow, it could be the liver, or it could be there are many factors for the formation of the blood. So then that rakta is produced. So when we call blood in the modern system of medicine, so according to Ayurveda, the blood has two parts, two components. One is the rasa part, that is the plasma part, and the other is the cellular part. That is actually rakta, according to Ayurveda, not blood as a whole. Only the cellular part. Then the third is mass, muscular tissue. Then the med means the adipose tissue. And then the asthi majja. Asthi means the bone, bony tissue. Then the within the bone, that bone marrow, and then ultimately the hormones, the sex hormones or the androgens or like that. That is the shukra part. Shukra. Now, the health means because the topic which we are going to discuss today, that is the health. What is the health of the organs, and what is the role of Ayurveda in maintaining the health of the organs? Now, as I told you that the metabolism of the body, that is dependent upon the basic body-mind constitution. Means whether the person is of Vatic constitution or Pitta constitution or Kapha constitution, accordingly, the basic metabolism of the body system, that is maintained. Similarly, of the psychological system, means the mental system, that is Sattva, Raja, Tama. This is the best. But there are two other factors which are very, very essential for the maintenance of the health, and that is one is the metabolic fire, which in Ayurveda we call it as Agni. Not only the digestive fire, but also the metabolic fire. So that is important. Or in simple words, you can say that various kinds of these ferments, digestive juices, then the hormones, other things, they come under this Agni. And the second is that is the channels. And the channels in our literature, we call them as srotas, the channels, the macro channels and the micro channels. So all the tissues, they have their channels, rasvaya srotas, raktavaya srotas, masvaya srotas, like that. Now the transformation transformation is resulted because of the action of the Agni on the different tissue elements. According. Now, so the first is the digestive health. Now, there is a concept today that microbiota. So diet, if we have the balanced diet and the digestive fire is okay and the digestive tract is okay, the movements or the other activities of the digestive tract, if they are okay, then it means the digestive health can be maintained. Now, for maintaining the digestive health means proper digestion, proper absorption, and then from after the absorption, there is proper assimilation in the body system. So all that is controlled under the control of that is digestive juices, which in our Ayurveda system we call it as Agni transfer, digestive. So after the assimilation, then the different types of Agni, which we call as a tissue fire. So different tissues like Ras Agni, Rakt Agni, Mas Agni. Now, the keeping all these Agnis in balance, in equilibrium, it all depends upon what kind of food and how we eat, what we eat, when we eat. So it all depends upon that. Now, like so, when the overall health is maintained, then it is also subsumed in that the health of the organs is also maintained. But according to the prakriti of the individual, if there are certain lifestyle indiscriminations or the dietary indiscrimination, so according to the indiscrimination, certain organs, so there are specific involvement of those organs and the functioning of those organs that get deteriorated. Now I tell you one thing. Now, suppose if a person is of pathic prakriti, pathic type. So pathic prakriti individual, they have more fire in the body system. As you know that we have 5 elements in the universe as well as in the body system: Prithvi, Jal, Agni, Vayu, Akash. So if the person is of pathic and prakriti, the pitta is dominant in the body system, it means the fire content is more. And in the same person who is having pathic prakriti, if he is taking more spicy food, the hot foods, salty foods, where the fire content is more, then that what will happen? There could be the chances of gastritis, then the hyperacidity, right? So it means the person who is a pathic prakriti, he has to avoid excess intake, excessive consumption of the spicy food, the hot foods, and other things. And another thing is there. No, sometimes what happens? Okay, you are not taking spicy food, you are not taking hot foods, you are not taking excess of this salty food or this astringent food, but you are taking certain dry things like chana, besan, if a pathic prakriti individual. So what will happen? The kapha will be reduced. So when the kapha will be reduced, because kapha is lubricant, or you can say like the kapha of the alimentary system is the mucus. No, so if that mucus is suppressed, so the action of the digestive juices like the acid, that will be augmented, that will be enhanced. So that will cause inflammation in the gastric tract, gastrointestinal tract. So means the health of the digestive tract, it all depends upon what is the basic constitution of the individual, means the Vatic individual, Pathic individual, Kapha individual. So the kind of prakriti the person has, opposite to that, that kind of food should be taken. But again, it should be in balance. You might have seen certain patient, like if you see in Rajasthan. In Rajasthan, the climatic conditions are very dry, right? And if you see their diet pattern, they consume a lot of sweet things and a lot of this ghee, etc. Because that dryness is controlled with the help of those foods, right? And the fire there, the digestive fire, I think that is usually okay. But if you see the diet pattern of the Rajasthani people, they eat sweet things first in the food. They eat sweet things in the food. And in Ayurveda, it is recommended that sweet foods should be eaten first. Why? Because sweet foods, they give satiety. So once means you have taken the sweet food, it means the amount of food which you will take later, that will be reduced. Right? So this then other things. Now, if the pathic type of individual, if he is taking very spicy food, alcoholic beverages or other things, then that will adversely affect the seat of Agni. And the seat of Agni in our body system that is the liver. Right? So liver will be affected. That is why the alcohol consuming people, they have more problems, liver problems, whether it start with the fatty liver, then the cirrhosis of liver or like that. So the liver health that gets disturbed if a pathic type of individual. So it is means the balance, and that balance of the food items and balance in the lifestyle, that has to be in accordance with the body mind constitution of the individual. Right? Now, if you see the treatment part, that is the treatment of the different organs and how to maintain the health of the different organs, that is also very specific in Ayurvedic system. It is not general approach is not there. The selection of the drugs, the therapies, different therapies, those have to be selected, those have to be customized in accordance with the body mind constitution of the individual. Like suppose Brahmi, you must have heard Brahmi. Now Brahmi is used uh, for many indications, for many uses. It is used. Like it is good for memory, enhancing memory. It is also good for the skin diseases, right? Now, if you intend to use Brahmi for mental disorders, whether it is a loss of concentration or whether it is a lack of focus, if the memory is poor or like that, or if the cognitive functions are disturbed, those simple Brahmi, it will not work. You will have to make a preparation which is soluble in fat. So we make Brahmi Grita. Now, Brahmi Grita, that helps to the active ingredient of the Brahmi to cross the blood-brain barrier. Because unless the Brahmi components, they reach the brain, the effect will not be there. The effect will not be there. Right? Similarly, if when we give any Ayurveda drug for the kidney patient, although if a person is suffering from chronic renal failure, right? So that drug has to be water soluble because it will not reach the kidney, because through the blood, and then the blood is filtered, and when if it is soluble in the water, only then it will be filtered through the kidney, and then it will affect the kidney tissues or the nephrons or other thing. So these concepts are very strong, strongly advocated in Ayurveda. Now I give you one example. I think you might have heard Trifla. You know Trifla? Trifla churn, Trifla.
Yes,
It
yes,
is made
please.
up of three components: harad, bheda, and amla. No. Now Trifla, this powder, if we use powder, it is very rich in fiber. Right? So for the gut health, if the constipation is there, if the irritable bowel syndrome is there, or the ulcerative colitis is there, so in that case, we use Trifla powder as such. But the same Trifla, if it is to be used for anti-diabetic effect, then it has to be used in water-soluble form. So the decoction of Trifla that is used. Now, Trifla is also used for eye diseases, hypermetropia, myopia, means for the health of the eyes. So in that case, the triphala has to be prepared in ghee, triphala ghee, Maha triphala ghee. The simple triphala powder will not work because it will not reach the tissues of the eyes. Right? So these concepts are there. These approaches are there in Ayurveda system, means how to maintain the health of the different organs and restore the health of the organs. Now, I give you one example, and there is another theory in Ayurveda that the things which are present in the nature, there are many things in the nature, and the same kind of things are in the body system. So those things, the external things, they affect the body organs. Like if you might have seen this Karela. If you see the Karela, it looks like pancreas. Right? Now that Karela, that is why it is used in diabetes in Ayurveda. It is strongly recommended. Right? Because it activates the pancreas. Now carrot. If you see the carrot and you cut the carrot, आपको जो है वो अंदर आइरिस की तरह लगेगा. So carrot is good. Now it is proven that carrot has carotene, so that is why it is good for eyes. Walnut, it looks like brain. So walnut has certain lipids, phospholipids, which are good for brain. So that is why now it is proven that okay, the phospholipids are there or other things are there. So the walnut, but if you see the shape, it is just like cerebrum. Brain की तरह. Similar onion. Now onion, if you see the onion, it looks like prostate. Right? And now the scientific studies are there. Scientific studies are there that onion is useful in the benign prostate hypertrophy. Right? So the use of different drugs that is in accordance with this theory, this signature theory, and according to the basic composition of that material which we are going to use as a medicine. It is not on the outcome of the disease. Means that the medicines or the therapies which are prescribed to the patient for restoring the health of the organs or for the systemic health. So it is not on the outcome of the disease process, but to correct the disease process. Like, okay, if the pain is there, we do not recommend painkiller. The painkiller is not, right? If there is enlargement of the prostate, so there is no specific medicine mentioned in Ayurveda that okay, it will be useful in prostate. But how the prostate is enlarged, what is the mechanism behind that? So that mechanism is being corrected or that is slowed down. Now, like in case of this menorrhagia, metrorrhagia, the problem is in the endometrium. And endometrium, that is under the influence of the ovaries, secretions from the ovaries. And the ovary is under the influence of pituitary gland. So when there is pituitary, ovarian, and uterine axis deviation, it means we will have to correct the axis. So that axis is corrected. That deviation is corrected. Not any medicine directly acting on the uterus. You might have heard this one product, Ashoka Wrist, Ashoka Churna or Ashoka. Now, Ashoka, it corrects the pituitary, ovarian, uterine axis. It streamlines that axis. I would say certain very blunt things. Now, in the conventional system of medicine, now if a patient is tested for thyroid profile, and if the TSH comes high, thyroid stimulating hormone, right? So immediately the altroxin is prescribed to that person. Now, if you see our understanding, the understanding of Ayurveda is, now the TSH, thyroid stimulating hormone, it is the hormone of pituitary gland, not of thyroid. right? So if the T3 and T4, which are the actual hormones of thyroid gland, if they are normal and that only TSH is raised, what does it mean? It means that the T3, T4 hormones, they are failing to do their activities, do their functions because of the presence of certain opponents, because of the presence of certain antagonists in the blood system. They oppose the functioning of the T3 and T4. So if a signal goes to the pituitary gland, that is, I think you might be aware of this, how the hormones are controlled. The biofeed mechanism is there. So a signal goes to the pituitary gland that, okay, your thyroid is not working, stimulate the thyroid. So pituitary secretes more thyroid stimulating hormone. And when more thyroid stimulating hormone is secreted, then it comes to the blood. And when you get the blood tested, okay, the TSH level is high. But in our system, we do not give that altroxin to that patient or similar drug to that patient. We try to negate TSH by suppressing the effects of the opponents of T3 and T4, which have come into the blood system. Right. So these are the very scientific aspects that how the health of the different organs that is maintained or that is restored with the help of Ayurvedic medicines. So the organ specific health that can be maintained, that can be restored. First is the functional. If there is any functional deficit, okay, that can be corrected, no problem. But if the structural is, so every organ, they have, unless it is totally decompensated, the functioning of that organ is totally decompensated, then there are limitations of the medicines also, because every condition, every stage of the disease is not curable. It is not manageable. And certain disease processes, they are irreversible. Those cannot be reversed. So that kind of approach is also there in Ayurveda. Like the prostate, the prostate enlargement, it is not a disease. It is an age-related problem. After, like the menopause. No, menopause is not a disease. It will happen with every lady, every woman after certain years. After 45 years of age or like that, it will happen. But because of that natural changes in the body system in that organ or the associated organs, the lady suffers. They have certain symptoms and the painful symptoms. So those have to be controlled. So how to control them? So that approach is very specific in Ayurveda. It's not done. Like suppose um, uh, in the conventional system, if menopause is there and the symptoms are there, the hot flushes or like that, okay. Now there is natural decline of estrogen secretion, right? So how long you will continue to give this estrogen? But the symptoms resulting from the deficiency, from the less production of estrogen, then can be controlled. That can be controlled. So that approach, those kind of lifestyle changes and what kind of lifestyle modulation, the dietary changes. So these are already recommended in Ayurveda. These are recommended in Ayurveda, right? So now the bones. Now the bone. Suppose if we take a bone as an organ. Now, if you see, now today is, I think every third person is suffering from vitamin D3 deficiency. If you go for the blood test, okay, vitamin D3 is less, right? No, if the vitamin D3 comes out to be less, the doctor will immediately prescribe, okay, give vitamin D3. Give vitamin D3. Right? Now, if you see the vitamin D, it has two components, D2 and D3. Now, one component, it comes from the sunlight, exposure to the sunlight. And the other 60 to 70%, it comes from the diet. In spite of having, in spite of having good vitamin D components in our diet, we suffer from vitamin D3 deficiency. Why? So again, that exposure to the sunlight. So these approaches are there. And I think now the time is going to be over. I finish my talk. And I would invite certain questions or queries. Then I will respond back to them. Thank you.
Thank you very much, Dr. Katoch, for giving and enlightening all of us about the role of Ayurveda in keeping our organs healthy. And your approach, the way you have spoken today, it's very, very clear that the body components and what Ayurveda can do, and if we will take those precautions and we accept and we adopt those things, definitely we can keep our organs healthy. And especially like you have mentioned about the liver and kidney, as well as bone marrow and everything, even eye and the bones, etc., which are very, very common organs and tissues. And I'm sure that today's program is very, very enlightening. And I would like to inform all my members as well as the viewers who are watching us live or who is going to watch live afterwards, that Dr. Katoch is an authority in Ayurveda because he was with the government, and he is a person who openly says that because there are no much research has been done, or whatsoever research has been done, it was not being publicized as what allopathy is doing. So unless the allopathy people who are doing the research, if they will not come out openly and do these things, publish their papers in journals, etc., then it is not easy to promote the Ayurveda, which is the oldest form of our treatment or holistic treatment, what we are seeing, especially in India. And he has also mentioned in one of my program very clearly that unfortunately the integrated medicine which we talk, where the person who is practicing for Ayurveda is also integrating with allopathy, but he is not doing it scientifically. And that's why today, and when I asked this question to him, and he also agreed at that time in that program, that all the major hospitals in India are having BAMS as the RMOs, who are sitting in the night and prescribing the medicines of allopathy, although they were taught basically they are trained for the Ayurveda. So is it correct or not? And his reply is very clear. If a person is having full knowledge of Ayurveda, he can very well do it for Ayurveda. But if he wants to do practice, then he should have the full knowledge of Ayurveda as well as allopathy. Then only he can do it. So he is very forthwith, straightforward. He will never mince his words. Whatsoever things he speaks very, very nicely. Now, my question before I will open for all the members to ask the question, Dr. Katoch, is you have mentioned about the how we can keep our organs healthy. Very nice. But suppose tomorrow one of my kidney or both our kidneys fail, or the liver fails. Is there any treatment in Ayurveda or not?
Yes. In Ayurveda, if you see, there are authoritative books of Ayurveda, and these books are listed in the Drugs and Cosmetic Act, the authoritative books of Ayurveda. And primarily, the 6 books, these are the most authoritative books: Charak Samhita, Sushruta Samhita, Stang Hridaya, then the Madhav Nidana. Now, when the kidney or the liver or the heart are involved, the background problem is always the erratic lifestyle. It is always the erratic lifestyle. It means there is some deranged lifestyle of the person, and because of that, he has suffered. Now, if you modulate the lifestyle, and according to Ayurveda, that modulation has to be done in accordance with the body-mind constitution of the individual. There is no standard lifestyle across the globe. We cannot advocate one particular lifestyle. It has to be individualized. It has to be customized in accordance with the body needs of the person. right? And the strongest point of Ayurveda is that Ayurveda works on lifestyle factors. The other factors we cannot change. No medicine can change the age of the person. No medicine can change the sex of the person. No medicine, whether it is Ayurveda or allopathy or homeopathy, no medicine can change the hereditary characters of the individual, right? No medicine can change the living conditions, the environmental conditions, right? What you can change the lifestyle. And that change has to be made in accordance with the needs of the body, right? So accordingly, and according to the body mind constitution, so the prakriti, the metabolic fire index, what kind of agni is agni, and what is the status of the channels, right? Now, I am a physician also. Almost every week, one or two kidney patients, they come to me, not only from Delhi, from outside also. They take teleconsultation. One patient from Italy is, for the last 2 years, he's taking treatment. So what we are giving now, the question which you have, the how to take care of kidney. Now suppose if the kidney, the failure is there, kidney, chronic renal failure is there. Okay? Creatinine is rising and urea is rising, right? No. In the conventional approach, what we give, because when the kidney failure is there is swelling also in the feet. So we give diuretic, right? But according to Ayurveda, we never recommend diuretics. Why? When the kidney is already diseased, the kidney should be rested rather. Why to do the forced diuresis with the help of the medicines? And if you see I told you that the functional definition of the Shariram. So according to Ayurveda, the concepts, the fundamental concepts of Ayurveda, the urine is not produced in the kidneys. Rather, it is produced after the digestion and the, right? And after the digestion of the food, that food part, that digested food, that is converted into two parts. One is water soluble and another is insoluble. The insoluble part, that comes out in the form of stool, and the water soluble part, that gets absorbed, and then it goes to the blood. From the blood it goes to the kidney, and from the kidney it is filtered. Then we call it as urine. But the origin of the urine, that is in the large intestines, from where the water soluble portion is absorbed, right? So in our case, in Ayurveda, what we do, we give laxatives. So the water which we intend to expel from the body, that should be expelled through the anus, not through the kidney.
Okay.
Right? But if we force the kidney to make more urine, it means we are damaging the kidney.
So according
we need
to
to give rest to the kidney.
so according to you, Doctor, yeah. So according to you, Dr. Katoch, if we give the rest to the kidney, then the kidney's function will be less, and then the patient can survive without any kidney transplant.
Repair remedies are there. Repair. Now I have one patient about 3 months back. His creatinine was 3.9. Right? Now it has come down to 1.4. Right? We are not giving him a diuretic or anything, but the lifestyle modulation means particularly the diet, which kind of diet he should take. So he is following that, and we have certain giving certain medicine which can help in the regeneration of the renal tissue, the kidney tissue.
Okay. Okay.
We have
So
organ-specific tonics.
Okay. So thank you, Dr. Katoch. From my side, now it is open. I think Dr. Nitika Gupta wants to ask.
Yes, thank you very much, sir, for the insightful talk that you gave. I just wanted to inquire about something known as the non-alcoholic fatty liver is majorly on a very rise these days. So many people get it. So even if, one may not be maintaining a sedentary lifestyle, just say, for example, walk is a part of someone's routine, Like, so it's not completely sedentary. Then what is it that you recommend through Ayurveda that one should do to actually overcome the fatty liver? And there are like various grades of it, and from which grade do you think it is reversible, without any transplant as such?
Now, the fatty liver means the grade 1, grade 2. So up to grade 2, it is reversible. It is reversible. So from the grade 2, we can bring the patient to the grade 1, and then after grade 1. But the important thing is that the kind of food that person should consume. This is very important. Now, the food items like thick gravies, the fat-rich food, the creamy food, right? And the vegetables, which are very lubricating, or you can say that slimy foods like the bhindi, arbi, urad ki dal, rajma. So we recommend that, okay, these should not be taken.
Okay.
Okay? And since you have asked the question that about non-alcoholic, right? So, okay, the normal individual, if the and if we have identified his prakriti, what is the body mind constitution, and accordingly we prescribe the diet for him, and in that diet these things have to be avoided.
Okay.
Right? And the third, so this is the thing.
Thank you.
Thank you, Dr. Katoch.
I give you one example. I just give you one example. You know that Amitabh Bachchan, 50% of the liver is damaged. But how active he is at this age of 80?
Yes, please.
80% in his damage.
Yes.
It means because the reserve of these vital organs is very, very high. Like in case of heart, unless 75% blockage is there, the patient does not have any symptom.
Okay.
Similarly, in the kidney, when more than 70 to 80% damage is there in the kidney nephrons, only then the creatinine starts rising.
Okay. Thank you, Dr. Katoch. Yes, Dr. Rotarian, Dr. Sudhir Saran wants to ask. Yeah.
I have one point. The origin of this system of medicine is in our holy Vedas.
Yes.
And today's education system is not living up to the teachings of the Vedas.
Right.
So today being Guru Kripa Day, Guru Purnima, which of your teachers inspired you to raise the study and teaching of Ayurveda when you were a student?
Very interesting question. I was born in a small village in Himachal Pradesh, right? After 8th standard, I came to Chandigarh. I studied in DAV College, DAV School Chandigarh, and then the DAV College Chandigarh. And at that point of time, there used to be entrance test for admission to MBBS course. So I did my pre-medical, right? I did my pre-medical and I applied for entry into the MBBS course. And I applied only for this All India Institute of Medical Sciences, right? And I missed the admission by 1 mark. I missed. My parents, they were not in a position to wait for 1 more year, right? And they took me to the Ayurveda college and I got admitted there, right?
Okay.
And fortunately, the college from where I studied Ayurveda, that is one of the oldest colleges of the country, and that was set up in 1898 in Lahore. And after partition, it was brought to India, that college. And initially, that was started in Ambala, and from Ambala, it came to Jalandhar, Dayanand Ayurvedic College, Jalandhar. And I was the first student of the first batch of BMS. Right?
Okay.
No, you just listen to the story. And I was fortunate enough that my teaching was totally integrated. Our duties were there in the civil hospital. We were also sent to the mental hospital, Amritsar, right? So the modern knowledge and the Ayurvedic knowledge. Then I did my post-graduation from National Institute of Ayurveda. Then I became teacher in Ayurveda college for 10 years. Then in 1992, I got selected through the UPSC and I came to the central government. First, I was the physician to the central government, Ayurveda physician. And then after 7 years, then I was inducted into the ministry for policy, planning, technical advice to the government. And from there, just after 7 years, then I went to WHO. Okay. So this is all about how you are oriented, right? The application of the knowledge is important if you have the knowledge. I think very rightly, one English philosopher has said that to know that you know what you know, and to also to know what you do not know, that is the true knowledge.
Yes. Thank you.
Now the problem is, I think the question is very, very, very important question he has asked. Now in India, if you see, there was a tradition to drink milk in the night,
Yes.
right?
Yes.
Drink milk in the night, and Ayurveda says, Div Sante Peya. At the end of the day, you must take milk, must consume milk. And milk is also a universal refreshment. Every sportsperson, he consumes milk, right? So why it is consumed in the evening hours or at night? Now it is scientifically proven that when you drink milk, the blood serotonin level rises. And serotonin, it gives mental relaxation, so you get sound sleep. Milk helps in induction of sleep, right? Another example, Ayurveda says, or the Indian tradition says, what I think in the Vedas also, Brahme Murte stage, get up early in the morning. पहले यही कहते थे ना, अर्ली टू बेड एंड अर्ली टू राइज, ठीक है? तो वो आजकल आदमी जो है 21 तारीख को उठता है और सोता जो है 22 को है, ठीक है? 21 तारीख को उठता है और सोता जो है 22 को, 12 बजे के बाद सोता है। और वो जो रात को जो 11 बजे से लेके 2 बजे का जो टाइम है जिसमें हीलिंग हार्मोन्स निकलते हैं, उसका क्या होगा? अगर आदमी जागता रहेगा उसका इफेक्ट ही नहीं होगा। मेलाटोनिन, डोपामिन, सेरोटोनिन, ये जो हीलिंग हार्मोन्स है वो निकलते हैं उस वक्त। और आदमी जो है आजकल जो है वो लैपटॉप लेके या जो मोबाइल लेके जो है 12 बजे, 2 बजे, 1 बजे तो तुम्हें सोच है, वो आदमी सोच रहे हैं कि हमें हेल्थ मिल जाए। हेल्थ डज नॉट कम फ्रॉम पिल्स एंड कैप्सूल्स, इट कम्स फ्रॉम द लाइफस्टाइल, एंड लाइफस्टाइल हैज 4 कंपोनेंट्स. One is diet and nutrition. Second is your routine, right from getting up and going to bed. Third is your behavior and the habit. Unless you have healthy habits, okay, you cannot have health. And the fourth is the mental peace. So these are the 4 components. These are the 4 building blocks of the lifestyle. So whether these are right in the present context, आजकल देखो आप कौन से चारों कंपोनेंट ठीक है, राइट? अब देखिए ब्राह्मण मुहूर्त और तिष्ठित, अब जो है साइंटिस्ट जो है यूएस के साइंटिस्ट जो है वहां पे काम किया कि क्या मतलब क्या है इसका। अब देखा कि वहां पे जो है व्हेन यू गेट अप अर्ली इन द मॉर्निंग द ब्लड कोर्टिसोल लेवल इज हाई, एंड व्हेन द ब्लड कोर्टिसोल राइज यू हैव गुड फोकस, गुड अटेंशन, गुड कंसंट्रेशन। इसीलिए उसको ब्रह्म मुहूर्त कहते थे कि सुबह उठ के पढ़ो। आजकल जो है रात को पढ़ते हैं, सारा दिन जो है इधर उधर जो है आपका बॉडीली टेम्पटेशन में लगे रहे, कहाँ आपकी कंसंट्रेशन बनेगी? रात को जो आप 1 घंटे में जो कोई चीज समझ पाते हो, सुबह जो है 10 मिनट में समझ में आ जाएगी। योर अलर्टनेस इज हाई। तो ये जो चीजें हैं जो लिखी हुई हैं, आप कहने का मतलब आप इसको जो एक्सप्लोर करोगे साइंटिफिकली, तो एक चीज है मैं बताऊं आपको, द थिंग्स विच आर रिटन इन आयुर्वेदा, they are time tested, they are tested in the laboratory of time, they may not be tested in the laboratory of science.
Yes.
But there is a need to validate those things.
Yes.
यही सबसे बड़ी प्रॉब्लम है कि हम जो है ये कहते हैं कि ट्रेडिशनल है और इसको जो है हटा दो। नो, इट इज नॉट एक्सेप्टेबल। मैं ये कहता हूं कि जो मॉडर्न मेडिसिन है टुडे, इट हैज आल्सो बिकम ट्रेडिशनल। आप देखो जरा, blindly जो है the antibiotics are prescribed to the doctor patients. There are reports that 50% of the surgeries, they are unwanted surgeries which are done.
Dr. Katoch, before because of time is paucity of time, I will just say right now today these Ayurveda medicines are available OTC, over the counter. Person can go and ask for any Ayurveda and that person will give it, because there is no prescription is there for the Ayurveda, and the herbal medicines are there, herbal things are available all over the world. Your view for that, but the time is short, so I would request you for a minute or two, because that is very strong views I heard in the earlier meeting. I want our members to know.
Taking Ayurveda products or consuming Ayurveda medicines without following the principles and the concepts of Ayurveda is not Ayurveda. It's not. Right? If we do not know the properties of that medicine, if we do not know that what it would do in the body system, right? And it is the duty, or it is the responsibility of the practitioners to prescribe that medicine, not of the consumer to take it directly from the chemist shop or from the shop. Right?
Okay.
So this is a mockery of our system.
Okay. And what about herbal?
Herbal in India, the term herbal is not there in the Drugs and Cosmetic Act. There is no medicine as herbal medicine. Herbal means of plant origin. Any material, any product, or any medicine made from the herbs or from the plant original materials, that we call as herbal. This concept of herbalism or herbal medicine, it has come from Germany. But if you see the Drugs and Cosmetic Act and the Drugs and Cosmetic rules, only 4 kinds of drugs are allowed in India. One, the pharmaceutical drugs. Second is Ayurveda, Siddha, and Unani drugs, means the system drugs. There are specific system, right? Third category of drug is homeopathic drugs, and the fourth is phytopharmaceutical drugs. Herbal drug as such is not there. No.
Okay. Okay. Thank you very much. And over to you, Rotarian Ritika Gupta.
Thank you very much. As we are moving towards the end of the session, I now request Rotarian Ramnath Pradeep to please give a vote of thanks.
Yes. Today, Dr. Katoch, our President, Mr. Goel, this is really very heartening to know today. Will all of us have come to know what is the difference between, because generally everybody avoids, because everybody is believing the immediate relief. That's why the people are going for more of a allopath doctor and allopath medicine. So is there any where the immediate relief can be obtained from the your system?
No.
So is it
immediate
question? Okay.
No, I'm just seeking the clarification, so that today is the issue. Everybody goes to the immediate relief, because the doctor has also said that 75% when the damage is already done, the people come to the doctor. Otherwise, they don't come.
The people, they want to seek immediate relief only from 2 symptoms. One is pain and second is fever.
Yes.
Right?
Pain
now,
is the
if
one.
you see, if you see the drugs, the chemical drugs for pain, I think the most potent drug, that is morphine, pethidine. Okay.
Yes.
So that has come from opium, and opium has come from Ayurveda.
Okay.
Now the thing is, opium as such is not available to the Ayurveda practitioners because there is a narcotic bureau.
Correct.
Right? So this is the thing. The remedies are there. Remedies are there, but these are not manufactured. These are not manufactured because not allowed.
Correct.
Legally not allowed.
Okay.
So doctor, it's really heartening to know many of the things. Thanks to
No. I think all of you might be knowing that this cannabis alkaloids. I think these are randomly or rampantly manufactured in US. Cannabidiol or other thing, but not in India, because it is not allowed as per our Drugs and Cosmetic Act and as per our Psychotropic Substances Act. It is not allowed.
Correct.
Even the cultivation of cannabis.
So, Dr. Katoch, it has been really very, very enlightening on those issues. which as presently we are not following what the lifestyle is required to be followed. There are some important things that we must change our lifestyle. Probably that will help a lot for keeping our health and all our organs in a particular state of affairs. So it was really very, very enlightening, all of us, all the members of the Rotary Club of Organ Donation, to see observe your observations as well as your advice to all of us, saying that you must change your lifestyle. Like you have given a very good example. I remember my mother, grandmother used to say that you must drink the milk in the night.
Yes.
Before go for the sleep. Now everybody today we are dead.
Time is running out.
Particularly, Dr. we will
Time
not
is
get
running
the
out.
time.
Please.
Mr. Goel, I'm sorry to say, we don't get time this time of this type of.
So what I will do, I think the best is that I will share, if Dr. Katoch allows, I will share Dr. Katoch's number in the group. Dr. Katoch, is it okay that our members can interact with you directly? So if you don't,
yes,
if you don't
I am
mind.
giving the WhatsApp number. I am giving the WhatsApp number.
I have your WhatsApp number. I will be sharing to you. Okay.
Okay,
So
fine,
I would
like.
Thank you
Thank you very
so
much.
thank you.
Thank you very much to all.
Thank you very